So, okay, fantastic. Good evening, everyone. Welcome to Medical Mondays. We have a huge topic tonight. But before I go into that, Toyin Okwesomi, popularly known as Dr. O. I'm a family practitioner, HIV specialist, and I treat addictions in Maryland. I'm in private practice, but what I have fun doing most is what we're doing now, disseminating current congent medical information and learning from one another. Tonight, we have our own esteemed Dr. Louis Ashby, who is a board certified lifestyle medicine internist who obtained a medical degree from Yale University School of Medicine. Dr. Ashby completed her internal medicine training at Yale. If anybody does not know where that is, it's in New Haven, Connecticut, where she also served as chief resident of the Yale Primary Care Internal Medicine Residency Program. She moved to Florida in 2009 and has, after 15 years of practice, transitioned her medical service to focus on prevention of disease and reversal of chronic disease using lifestyle. Dr. Ashby's medical experience in internal medicine has led her to create a space for wellness where she integrates healing modalities with the best of Western medicine without the emphasis on pharmaceuticals. Her practice is to reverse disease rather than manage symptoms with medications. She addresses the root causes of chronic diseases. Dr. Ashby's board certification in lifestyle medicine allows her to prescribe food as medicine. Her background as a professional bodybuilder helps her patients learn about movement, exercise, and supplements that can promote healing and well-being. Dr. Ashby also teaches by example, living the lifestyle herself. In her practice, Dr. Ashby spends a lot of time teaching patients about lifestyle. She conducts free Zoom seminars on healthy aging and also does cooking seminars online to promote health. I have attended some of those lectures myself and have benefited from every single one of them. Dr. Ashby's internal medicine knowledge can safely guide and advise patients who are on medications and interested in resolving their lifestyle-related medical conditions off medications whenever possible. Conditions amenable to lifestyle therapies are diabetes, high blood pressure, obesity, high cholesterol, heart disease, chronic disease, and a lot more. Dr. Ashby helps our patients achieve healthy longevity, and her integrative practice in Saratoga, Florida accepts insurance and is accepting new patients. I can also add that Dr. Ashby has, helped me out personally. I have consulted with her. So join me in welcoming Dr. Ashby to discuss this important topic of cancers and how to prevent some that are lifestyle generated. She's going to scratch the surface today, so stay tuned because we're going to have many more sessions where she'll be able to dig deeper into these cancers and prevention. So welcome, Dr. Ashby. The floor is yours.
Thank you so much, Dr. O. And I'm a little bodybuilder, not a big one.
Oh my gosh. I hope you have that picture that you showed us last time. You are fantastic.
Thank you so much for the detailed introduction. And as was mentioned, I'm very pleased to be sharing the discussion time with you today and focusing our talk around cancer prevention and how lifestyle fits into that. And it'll probably be just about 30 slides, and we'll take all questions at the end. And so Dr. O mentioned that I am a board certified lifestyle medicine internist and mentioned my training. So I will skip that. We'll keep going to the next slide here. If my laptop will listen to me. There you go. This year, I celebrate 25 years as a healthcare professional. My journey did start when I was a registered nurse in 1996, and I am doing now what I enjoyed doing most when I first started in healthcare, and that is connecting with patients and educating them. I consider my job as a doctor to be one of an educator, and I transfer knowledge that I know that can help a partner in health make the right decision for themselves. I've been very pleased to find lifestyle medicine as a specialty, which is allowing me to focus on the prevention aspect of healthcare. So cancer, when that diagnosis and word comes up, it's often so scary and debilitating in so many ways. And when we think about it, when someone else has it, we often wonder, well, is it genetic? And breast cancer, which is so prevalent, for example, the first thing people gravitate to, well, do they have that BRCA gene? So as we know, there are some genes that are responsible for the mutation and propagation of cancer cells. But the facts are that actually 40%, and in some studies more than that, are 100% preventable cancers, meaning they're not there because of a gene mutation solely. And a lot of times, even when there is a gene mutation, the cancer continues to propagate and spread because the ability of the body to repair DNA damage is being really confounded by poor lifestyle choices. This year, we'll also celebrate the 50th anniversary of the Declaration of War on Cancer. Back in 1971, our president declared a war on cancer because suddenly we had millions of Americans dying of cancer. And the march was supposed to be for a lot of resources and attention to go into not only curing these cancers, but preventing and eliminating them. And where are we now, 50 years later? Unfortunately, is quite embarrassing. I have to mention that although a lot more people are surviving their cancers, we're getting more cancer survivors, for example, of breast cancer and other cancers like colon cancer when they're detected early, but the rate of incidence is rising as the prevalence, meaning the number of people who are being diagnosed and are living with cancer, has steadily risen since that war declaration was made in 1971. In fact, if you look at this slide, just before 2020, we can see that from 1975, we went from 3.6 million to 16 million around 2020. And the projected case numbers are up to 26 million in 2040. So unfortunately, cancer is on the rise. But fortunately, we know why. And a lot of that can be prevented. And that's what we'll focus the rest of our talk on today. What you'll also see in the slide are the age groups for which the cancers are on the rise. Most cancers are diagnosed when people are in their 60s and 70s, but most people who are living with their cancers and dying of them are in their 70s and 80s. So as we get into middle age, that's when the damage that's accumulated from our cells that has not been repaired with a proper lifestyle does show up as the cancer. So a lot of people who are surprised by their cancer diagnoses in their 60s and 70s, they've actually been on the road to that diagnosis for decades. Let's talk a little bit about the most common cancers. That's what we'll focus on today. For women, the most common cancer is breast cancer. More women have breast cancer than any other cancers. For men, they have more cases of prostate cancers. Okay. The second most common cancer in both men and women is lung cancer. We just heard an anecdote before we started of somebody's family members suffering from that. It is also the most lethal cancer of the ones that I've listed so far. So lung cancer takes more people and more survivors happen with both breast, prostate cancers. The third most common cancer between men and women is colorectal cancer. And we know how common that is. Multiple people in the public eye have suffered from this, and it still continues to be a major issue in our communities. If we take breast cancer as an example and magnify that cancer, it is the second leading cause of cancer deaths in women. I mentioned lung cancer was very lethal, so it kills a lot more people. A lot more survive who have had breast cancer, but it's still the second cause of cancer death. Of course, the overall cause of death in Americans and worldwide is cardiovascular disease, which we've touched on here before. The second leading cause of death is cancer. 1 in 8 women will have been affected by this, unfortunately, and that's a very large portion of the population. On the right side of the slide here, we look at some of the risk factors. Genetics. The genetics account for 5, maybe 7%, depending on the studies that are being cited, of the true genetically driven breast cancers. Most women who have breast cancers do not have the BRCA mutations, or it is not genetically driven. If someone has a perfect lifestyle and has breast cancer, perhaps that person might have the gene, and it's in that small subset of the population, less than 5% in some research, epidemiological research data, less than 5% have the genetic mutation that directly led to cancer. It's a very small part of the risk pool. Of course, being female automatically increases the risk of breast cancer as compared to being male. And over 50, so postmenopausal, is a time when that tends to also rear its ugly head. Alcohol has been directly linked to several cancers, including breast cancer. Other toxins like smoking directly linked to cancer promotion by way of DNA damage. Same with ultraviolet light and other X-rays that people might be exposed to on a repetitive and excessive basis. So aside from these common risk factors that can increase the cancer rates, especially breast cancer, we have some items here that do prevent the cancer, and we will discuss them in more detail the rest of the talk. But in general, when you say lifestyle, these are the things that we really refer to: exercise, stress levels, diet, control of the weight. And by weight, I mean obesity is directly linked as a predisposing factor to breast cancer. Preventive examination, so early diagnosis can help in the prevention. And so these are the things that we can focus on in lifestyle, and that will actually help that 40% of people who unnecessarily battle with cancer. just to dive a little bit more into some of the other risk factors that we may not hear about very often, the breast tissue density has associated with it a higher risk of cancer. So if someone tends to have more fibrous or dense breast tissue, tends to have abnormal mammograms, tends to have fibroglandular breast tissue, that may be something to watch more carefully, as there is an association between that and the further development of in situ breast cancer. Family history is another thing. This is where the actual gene might be an issue in terms of propagating it within a family, or environmental pressures in the family. For example, the way that mom ate, the way that they fed the daughter, and the environment in which they grew up might be an issue. And of course, advancing age has with it the inherent risk of more DNA damage that might not be repaired appropriately. Again, what are the lifestyle factors? This is just in broad strokes right now. We'll get a little bit refined with the coming slides on what does it mean to keep a healthy weight, what physical activity and how much. Getting enough sleep is important, but making sure that the sleep quality is restorative is also important. No alcohol use if you don't drink, but if you do drink, how much? 1 glass for women, 2 drinks for men. And smoking, I often take for granted that most people would understand that it is toxic and actually directly causes free radical damage to our cells, but it's a habit that I still see people with. So we shouldn't forget about smoking. Breastfeeding your babies. Interestingly, one of the key items to reduce the incidence and prevent breast cancer is to have pregnancies. This is not if you don't want them, but if you happen to be pregnant, the hormonal shifts that happen during that period are protective. When someone breastfeeds following the pregnancy, the breastfeeding activity maintains that hormonal state. And that's why many women who breastfeed don't have return of their periods. And by that, the risk of breast cancer is reduced. It's kind of like being pregnant and continuing the pregnancy and not having the high shifts in hormones that can happen when someone's menstruating monthly. So breastfeeding is protective in that way. So how do we prevent a third to 4 out of 10 to 40% of these most common cancers? Again, highlighted here in these bubbles are the relative incidence of cases of the most common cancers. And as you can see, when we combine men and women, colorectal cancer becomes a really big pile. And breast cancer continues to be the largest cancer among women. And we also have endometrial cancer, and for men, prostate cancer that will be relevant for our talk. Some of the lifestyle changes that do help with prevention, I'll go a little bit more in depth here. In addition to the smoking that eliminates free radical formation. Again, when someone's not smoking, if they're exposed to secondhand smoke, you're essentially smoking. If you're able to inhale it, whether it's from a carpet in the house where someone smokes and they're not around you when they smoke, that toxin's being inhaled, it's getting incorporated into the cellular metabolism, and the body is responding to that toxin. And we'll find out how. Smoking and toxin and different inhalants, keeping a healthy weight, being safe in the sun, meaning maybe avoiding the highest peaks of the sun exposure between somewhere around 11 and 3 p.m., but you still need enough sun to maintain vitamin D and proper immune function. Certain substances at work, there used to be a lot of asbestos exposure, and by that created lung cancers. And so more people are aware of that, and employers are particularly careful about exposing people to that. One item that predisposes to cancers that we may not readily think about are chronic infections like HPV, human papillomavirus, which can happen on the cervix, which can then, if left untreated, progress to cause local inflammation and abnormal cell proliferation that leads to cancer. Same thing with Helicobacter pylori, noted here, which is a bacteria that can reside in the stomach. If left untreated for long, is associated with progression of cell multiplication and metaplasia, so abnormal function of the cell to a cancerous activity. Alcohol, a direct toxin, unless you're using the very red berries and using 1 a day for female and 2 drinks a day maximum for male as part of an anti-inflammatory practice. If you already drank, I would switch to those. A high fiber diet, we know in particular as it relates to colon cancer, how that can help. Avoiding unnecessary radiation, processed meat. Sure, many of you have heard that red meat is a carcinogen. We know that red meat is linked to cancer. So avoiding these particularly processed types of meats is an easy way to reduce your risk of cancer if that's something you're worried about in the long term. Air pollution is a little bit more difficult to avoid. That certainly has to be a collective responsibility item here with those in power to make decisions at higher levels for populations. But being aware of that, even in your own environment where you can get fresh air getting out of the house and breathing clean air is important. Breastfeed, I mentioned how that related to the improvement in the hormonal milieu for a woman who wants to basically reduce the risks as you get older, is to avoid the menstruation time, right? When a young girl menstruates early and menopause comes late, that's a long time exposing to shifts in hormones monthly, and that has an inherent risk for breast cancer. And just below that is be more active. The same hormonal shifts that happen when, let's say, someone eats something toxic that's carcinogenic, the opposite can happen when we exercise. So all of the pro-inflammatory markers that are increased when someone is eating toxic food or is exposed to toxic exposure, those are downregulated after specific types of exercise. Minimize HRT use. And this is very important to clarify here that the studies that show the link between hormone replacement therapy and breast cancer, and this is still true today, are when synthetic estrogen is introduced to a body. Synthetic estrogens are very loaded and high dose. Even when it's a very small amount that is used, the synthetic portion of the estrogen does regulate the receptors. And so a lot of women, when you measure their estrogen levels on synthetic hormones, it's very, very high. So you actually want to eliminate any use of any synthetic estrogen if possible. And that includes all contraceptives, because a lot of those have in it even low dose estrogen or medium dose estrogen. And so this is an important point to make here, because the synthetic estrogens are an issue. And conversely, for example, soy, which is a phytoestrogen, which was lumped into this whole sphere of estrogen, has been found not to be linked to breast cancer. So if a woman actually has intake of soy, is a breast cancer survivor, and is wanting to improve her health and wellness, it is recommended, it's okay to have soy products. Organic soy is okay. It actually has positive effects even on the BRCA gene mutation for women. And so we have to make the distinction here of naturally produced estrogen via plants versus the synthetic ones that we knew before that had the link to breast cancer. How does lifestyle work for cancers? Well, I'm going to introduce this concept here that lifestyle has the entire point of increasing the body's ability to reduce inflammation and increase antioxidants. When you have oxidants, or reactive oxygen species in the body that come from either toxins or excessive exposure to certain foods or from not enough sleep, thus reactive oxygen species do cause damage to the cells, even at the DNA level. That damage is repaired or repairable every day. One can argue that all of us all have cancer right now at different degrees. It's just how able is your system to identify a rogue cell and mend it, identify abnormal DNA and fix it. That part of the equation is what we're going to be focusing on when we talk about lifestyle for prevention, and a lot of lifestyle as well for treatment, co-treatment of cancers. So increasing the antioxidants primarily via food and movement is where we're able to make a big impact on the net balance when it comes to preventing these cancers. The last time we discussed how poor diet can lead to chronic inflammation, which can have a lot of different symptoms associated with it, and in the end lead to heart disease. Today, the same process via chronic inflammation, which can have all of these symptoms, we're going to talk about how it leads to cancer. As you know, inflammation is and has been a big topic for almost 20 years now, having made the cover of Time magazine in 2004. Inflammation, when it is chronic, is extremely disruptive to our organism and is the root of many conditions, including cancers. This article was published back in 2009, and this was after this topic had been on the cover of Time for at least 5 years, and people had been studying and becoming aware of that in the early 2000s. What we see here is that experimental models show evidence that whatever the trigger of chronic inflammation, whether it be food, lack of sleep, toxins, stress, infections that are not treated, whatever triggers chronic inflammation, whenever there is chronic inflammation in the body, it is associated with the most cancers and supports tumor progression. So what we have learned here is that the chronic inflammation is a key point in tumor genesis and progression. So infections, like we talked about with certain chronic viruses, bacteria, foods that cause inflammation that can be measured, the environment, obesity, as visceral fat is a pro-inflammatory organ. All of those, it doesn't matter which one of them, cause chronic inflammation. If the body has chronic inflammation, that environment is conducive to tumor genesis, propagation, and metastases. And this has been studied and proven in the literature. So a key point for all of us to understand is, what is my chronic inflammation level? Am I in a state of chronic inflammation? And if the body is, what's the most likely source of that? Because you don't want to be a setup or a good host for bad cells to propagate. The next part of the presentation will be a little bit technical because I know there are several physicians on the call, and I'm not a biochemist, but I would like to at least show that the work has been done by those who study cellular mechanisms and metabolic pathways. So chronic inflammation, which you talked about, can come by any way. If that is there and it's determined there, the measurable cytokines, including NF-kappa B, IL-6 in particular, all of them can activate certain cellular pathways that not only promote instability in our genome, which is where the mutations can happen towards cancer, but can also promote cell proliferation. Once that cell, abnormal cell, has been produced, that tumor cell is produced, separating, dividing, growing, proliferating, and causing them to have access to blood supply. The milieu is paramount to maintain the growth of that tumor if it's able to provide a blood supply to the tumor. All of this can happen with chronic inflammation as the baseline state. Of course, once the cancer has had a chance to grow and invade, it is then identified, but it's already late at that point for some cancers, specifically pancreatic and lung cancer, which are very lethal. So in short, we've had several studies, and there are meta-analyses that are groups of studies that have been studied that arrive at the conclusion that inflammation can shut down cancer-fighting genes. Chronic inflammation increases IL-6 and c-MYC. You have an inflamed tissue, high amounts of IL-6 is produced. Interleukin-6 is a pro-inflammatory cytokine that can actually be measured, and you see ulcerative colitis. The end result of these mechanisms is that the cell, is unable to, or is a reduced response to DNA damages that have happened to it. All this from just eating burgers or any other foods that happen to cause chronic inflammation in that particular body. This slide is busy. I'm not going to go into it. It is to make a point. This is cellular metabolism. This is the surface of the cell where it interacts with the outside. This is the inside of the cell, the cytoplasm. And this is the nuclear envelope, the inside nucleus of the cell. All of this has been studied at MIT, of course. They had to get that detail. They've confirmed that when DNA repair mechanisms are compromised, obviously, chronic inflammation expedites cancer. This was a mouse study. So when something is noted and it can be reproduced in models, mice, this is very important because it shows reproducibility. So there's a suggestion, of course, for humans that people with decreased ability to repair the DNA damage might be more susceptible to developing cancer associated with chronic infections or inflammation. And they give here the example of ulcerative colitis, which is associated with colon cancer, but it's a state of chronic inflammation, ulcerative colitis. So with this, we just want to raise the awareness to the importance of early detection and treatment of inflammation. So the rest of our talk will focus on inflammation, since you now understand how it actually has real cellular implication down to the level of our genome and DNA repair. So inflammation and cancer, very clear link, no debate about it whatsoever. We just have to figure out how do we take care of the inflammation in our bodies, okay? This is where lifestyle comes in with nutrition, exercise, stopping the toxicities. We can't take that for granted, unfortunately. Healthy relationships, we've known that connections, social connections, things like yoga and restful sleep impact our immune system. So those third of preventable cancers, let's go ahead and make sure we do all we can to see those numbers begin to dip instead of continuing to rise by 2040. So being tested for inflammation is important. Knowing your actual state is important, so you can measure it as you put in modalities and lifestyle measures to improve it. Early screening is also important. Having a colon polyp identified means you've possibly prevented a cancer. The polyp happened in an environment maybe that was low in fiber and high in animal protein that are known to be carcinogens. So there's a local inflammation. We have the polyp there. The polyp itself shouldn't be there. So there's local inflammation around the polyp. which in turn, in time, does, in many cases, lead to cancer. So having a polypectomy is a preventable act. So screening is important. So we all know that prevention is better than cure, but how active are we in actually implementing the prevention steps in our daily lives? So assessing for inflammation, I mentioned that. I'll point a few other factors that live around inflammation. Inflammation markers, the highly sensitive ones are great, but there are also other markers that can be checked by your doctor. Vitamin D, when we talk about the immune response and the body dealing with very early cancers, when DNA has been damaged, for example, the immune system is responsible for all of that repair. And when vitamin D is low, it is an issue. Vitamin D is a hormone. It also helps the immune system. So ensuring that it's optimal can be done. You can check the level and make sure you're optimal. Visceral fat is pro-inflammatory. So working long-term to reverse the amount of visceral fat is important. I touch on this a little bit. This is something called arachidonic acid, which is essentially an omega-6. Omega-6s tend to be pro-inflammatory. And in many studies of people with cancers who have very high levels of IL-6 and other people who have inflammation in general, their IL-6 levels will be very high. Omega-6, excuse me, not IL-6, omega-6. Interleukin-6 is also not good to have, but that's a cytokine. But arachidonic acid is an omega-6, and omega-6s are pro-inflammatory. On the contrary, EPA is an omega-3 that you might start to see on the labels of your omega-3s if you watch for that. That's anti-inflammatory. So if you have more EPA, your ratio will be low, and that's what you want. So metabolic age is another clue. You can get this from certain specialized scales. You can get them at the gym sometimes. Metabolic age tells you how quickly your body's been aging while you've been counting the years. If your body is about 5 or 10 years older than your chronological years, your body's probably inflamed. TMAO, this is a toxin that can be produced by a gut bacteria when it sees certain foods and other chemicals that it doesn't like, and it's directly toxic to the heart. Chronic food allergies can provide an environment where the body's constantly asking for repair and constantly inflamed. So if those are the case where your toxin is chronic food allergies, it's worth respecting because the body will demand a change. Sometimes it does this via autoimmunity, and other times, unfortunately, it does this by just stopping repair of cellular damage, which is cancer. So the insulin resistance score will tell about a person's insulin resistance status. Insulin resistance is synonymous to high levels of insulin in the body. High levels of insulin is a pro-inflammatory state. Insulin is a pro-inflammatory hormone. So if that score is very high, reversing the insulin resistance is one way to help prevent further damage down the road. I mentioned omegas in the nutritional states, but vitamin C is also very important in the cancer conversation in general. So we talked about stress management, social connectedness, nutrition, movement, and sleep. That's lifestyle therapy. It's not a magic bullet. It's what's actually going into the life on a daily basis. Is the morning breakfast killing you, or is it helping? Is the afternoon lunch killing you? Is it adding to the pro-inflammatory portion, or is it anti-inflammatory? At every step and every activity of the day, ask, is this pro-inflammatory? Am I doing myself in, or is it helping? Very small actions, but the doses over time make a difference. So I'll give a little summary here in reducing inflammation to prevent cancer. And you know now how inflammation is intimately tied to cancer proliferation, those cell dividing, and metastases. Plant-based nutrition. Why? It's high in fiber, it's alkaline, it's anti-inflammatory, and that's been measured. When you measure the plants versus animal foods, the plants much higher in antioxidants and many, many different kinds of anti-inflammatory agents. We won't get into all of them, but a lot of foods have good anti-inflammatory effects. If you stick with plants, you're probably better off than with animals. Zero sugar. Why zero sugar? When we test for cancer activity in any body, we're actually looking for glucose uptake. Cancer cells are extremely metabolically active and they love sugar. So if you're feeding your body sugar, the cancer cells are happy, even if they're not detectable yet, even if you haven't been diagnosed yet. You're giving your body what it needs to house cancer in the setting of inflammation. Processed foods, red meats, all of those are pro-inflammatory, and some even carcinogenic, which means directly linked to causation of cancer. What's good? Fasting has been documented as very helpful, not only in helping in the insulin, the high insulin states that are pro-inflammatory, but also when you fast, and this is in some protocols for cancers, you're obviously starving the cancer cell. And when you fast, the body gets rid of cells it doesn't need first. So fasting appropriately and under supervision when you're doing this cancer protocol is very important, and that's a very good tool. But even before the diagnosis of cancer, fasting is extremely healthy and tied to healthy longevity. How to fast is a whole other topic, but I just wanted to mention that as a modality. Checking for chronic infections is very important. A lot of people want to skimp out on the pap smears. Really, the pap smears are to check for HPV. HPV, human papillomavirus, is a known predisposing factor to cervical cancer, which affects a lot of people in our communities. So chronic infections with this virus causes a local inflammatory state that is conducive to the production of cancer cells. So that's why having a chronic infection like HCV, which is the hepatitis C virus, can also lead to liver cancer. In the world at large, hepatitis B infection is very common. Chronic hepatitis B, guess what? Liver cancer on the rise worldwide because of chronic hepatitis B infections. Chronic infections cause chronic inflammation, which is directly linked to the production and propagation of cancer cells. Same thing with H. pylori, and these have been studied. H. pylori, Helicobacter pylori. If someone has chronic GERD, always has reflux, always taking Pepcid, better get that checked. Do you have H. pylori? Easily treatable. In my practice, I've had patients with years of symptoms. Check an H. pylori test that have H. pylori, few antibiotics, infection is killed, and their risk of cancer and mortality decreases. Vitamin D levels being optimal for good immune function. I earlier was talking to a group about this. In COVID-19, the need for vitamin D optimization has been made very, very clear. Its effect on the immune system as a hormone has also been made very, very clear. So now we have a new level of respect for appropriate vitamin D supplementation to help our immune system. Omega-3s, now we're starting to hear more and more about that. It is anti-inflammatory. When you eat certain foods that are high in omegas, they may also have omega-6, which is pro-inflammatory. So knowing your levels is important, and knowing where to supplement is important. This ratio here, this is a little bit technical, but it's important to know if you ever get advanced testing. The bottom line is to make sure that you have proportionately good amount of omega-3 and some omega-6. The physical training and activity that's been studied is at least 150 minutes a week. That's about 30 minutes a day, 5 days a week of moderate to vigorous activity level. But the numbers are a little bit longer. If it's steady state and lower intensity, you need a little bit more time. By the way, the hormonal changes that happen in the body during exercise and after are so complex and so numerous that inflammation and cellular pathway that I showed, it would look just like that, but everything would be good. So the effects of exercise on the body can be measured at the cellular level. And because it's such a complex array of benefits, we always boil it down to exercise is good for you. But just think of that diagram in your mind. Every time you come out of exercise in a different state, you go in there a little bit tired, a little bit down, and you come out in a completely different state. That's the benefit of the hormonal pathways that are improved with exercise. So just to go into a little bit more detail about food tips, I include a few slides here on things you can, grab and jot down for direct application. Blueberries, blackberries, any berries. Berries have an anti-inflammatory effect that is immediately measured. If you were to eat a bowl of berries right now and you were in chronic inflammation, they could actually measure your levels and it would be lower. So it's actually a dose response and it goes away after you finish eating, which is the reason you have to continue eating it if you want the long-term effect. So the medication, instead of it being the pill for inflammation that you take forever, it's the food for inflammation that you take forever. So the berries, the vegetables, the kale, the greens, the nuts and seeds, all of these have different effects that they bring to the table, but are all helping with inflammation. Turmeric and ginger, we've mentioned, or gut bacteria, which is another major topic. If we help them, they can also help us. If we give them poor things to eat, they can also kill us. The sickest patients that I do have now that I do more outpatient work are my actual gut patients. If there's a gut issue, it's going to be very debilitating. So helping that entire population of microbiome that is coexisting with you is a very smart thing to do if you want them to continue to help you. So life after cancer, as mentioned, there are a lot of cancer survivors because our modalities are good, because early detection is good, because a lot of people decide after a lump, they're going to get a double mastectomy and not worry about it anymore. We have a lot of cancer survivors. So how do you go on as a cancer survivor? Well, you're back in the same lot as everybody else, trying to prevent a recurrence, which we know can happen. So all of these modalities that I just talked about apply for the cancer survivor as well. So I'll end on a couple of notes here. Foods that fight inflammation come by a lot of different names, produce a lot of different chemicals that we can go into in detail. I'm not a trained nutritionist. I learned a lot of this by virtue of interest. I also obviously study lifestyle, and so I'm constantly learning. Polyphenols are one of the categories of chemicals that some of the foods produce that can be measured and isolated, can be taken as pills, or you can take the actual food. Okay. Some of these other foods here, like turmeric, green tea, berries, celery, dark chocolate, antioxidants-rich foods. Okay, antioxidants have their effects in the cellular mechanisms. And so if we eat the foods, we have that effect. Okay, anti-inflammatory foods, some more here: flax seeds, the green tea, green veggies, lycopenes in tomatoes, so many different options, but this is just a little bit of an overview to get started. So in summary, we just wanted to touch on, the 50 years of war on cancer since 1971. And when you look at the graph, unfortunately, cancer is on the rise and projected to be even higher by 2040. That being said, it's a little bit hopeful that 40% documented cancers are actually preventable. And in some cases, half are said to be preventable. And these are the most common cancers that we talk about: breast, colon, and prostate. Ways to do that. What are the half that can be prevented? Avoiding toxins that are obvious and that lead to chronic inflammation. Now that we know the direct link between inflammation and cancer, how do we get to inflammation? Besides the plant-based foods, if you have any other toxins that were touched on here briefly, it would be to address those. But the lifestyle allows the prescription of the food to continue on fighting the cancers before they become clinically obvious. So I hope everyone is able to take away that they can repair DNA damage that happens as they live life. And the way to do it is to give our bodies what Mother Earth designed to help our cellular mechanisms repair itself. The body is extremely intelligent if we don't keep, going against it. So I'm hoping more and more of us doctors will end up on this side of the fence, that we're at the future now where the doctors are not necessarily just giving medicines, but involving the patient and using food, fresh air, and exercise to stay healthy. Our bodies will stay healthy unless we kill it. We try to kill it prematurely a lot of times. And in the case of cancers, 40% of them preventable is a big chunk. And I hope we can, begin to make a dent in our circles of influence. So thank you for your attention. And I'll take some questions.
Thank you so much. That was a huge scratch on the surface. That was loaded. I learned so much, I was taking notes. And I will go first with my questions. I have the advantage of doing that. So you talked about exposure to x-rays. I see lots of patients come, they coughing, they're asking for chest x-ray. They want CT scan all the time. Kindly comment on that, as well as this state of mammogram in a medical circle now, because all of the colleges are not in agreement on when to start mammogram, how often to do it, and reason why, the exposure to radiation.
So, I appreciate the questions because especially the second one. First, let me take the x-rays. Yes, over time, accumulated DNA damage can happen with excessive exposure to repeated x-rays. That's been proven. Occasional x-ray because of a cough or pneumonia, hospitalization. It's the patients who's had the serial x-rays from prolonged hospitalization, who's chronically sick and getting exposed, who's also getting DNA damage that is probably not getting repaired, who is at risk for getting the cancers. Tying the fact that mammograms have been something that some women avoid, not only because of comfort, but because of exposure or radiation, 1 a year is not the frequency that leads to the inability to repair the DNA. So most women who have their breast cancer identified in their 60s, they feel a lump, and many of them hadn't even been getting mammograms for 10 or 20 years. So the frequency of once a year, I don't want anyone to feel like that is the type of radiation exposure that leads to cancer. Second, if your body is able to repair DNA damage, you can be in the sun and get sunburn and get DNA damage. So the idea is, and that's still exposure to ultraviolet light. The idea is, how is the body able to repair that? And are you inviting more chaos by limiting the body's ability to repair DNA damage? DNA damage happens more often than we would want to know. So that's one. And the second question, we know that these particular recommendations come from boards of responsible and well-meaning individuals who look at data and epidemiological studies. For breast cancer, the mammograms are actually still age 40, but some people and colleges are pushing it a little bit higher. For colonoscopies, because of the epidemiology, because a lot of younger people are being identified, that's being pushed to a little bit earlier, like age 45 instead of age 50. So I think we have to recognize that every one of these recommendations is coming from a group of well-meaning and responsible individuals who are looking to give their best recommendation to the population, to the doctors that are practicing, and each doctor has to then look at the patient in front of them and say, based on your family history, your personal history, and all of these other risk factors, here's where I would go with you. And I do that with my patients. So some that are not yet quite at the age where they would get a mammogram because of their particular situation, I might have them get it. And some that are, waiting until they're 50 to get a colonoscopy, I would say, no, I think I would do it earlier. So it's a balance, especially for the recommendations.
Thank you. I have another quick one. Red meat. Is lamb, do you consider lamb red meat?
I believe so, yes. Unfortunately, I don't know if there are any other naturopaths on the call or any other physician who wants to chime in. The carcinogens have specifically been linked to processed red meat as well. So the hot dogs, the burger patties, the charred meats, anything that's blackened. So we know those cause cancer. And in fact, gastric cancer, very, very commonly associated with barbecued and charred meats. So it's carcinogen. So if the body is already not inflamed and there's an occasional introduction of something nice like ice cream, chocolate, that's not, high cocoa chocolate, or an occasional item, it's less of an issue than if it's a chronic exposure and the person has no way to repair damage.
Thank you. So I have some questions, lots of questions in the chat box, but if you want to ask a question and you feel it's too long to write, you want to ask it yourself, please raise your hand and you'll be called on to ask your question. So there's a question in there. Dr. Bill, I'll be right with you. I want to ask this question. Somebody asked, is it dangerous to get regular gel manicures that use ultraviolet light?
Well, the ultraviolet light is definitely an exposure source. It's a toxin. So once you know that, you have that answer. So is the body trying to help every time? Yes, the body's trying to help every time. But you've already checked that box. You've identified a toxin that you're chronically exposing yourself to. So you have to make that choice. The cases where you have someone with no lifestyle related risk factors, for example, they're not obese, they eat well, they're plant-based, they're active, they don't have a gene mutation that is identifiable, let's say breast cancer, for example, and they develop breast cancer, but they're the only source of toxic exposure they can actually go back to is makeup, that they're a star and they've sat in that chair for so many hours their entire career, and they go back and they learn about all the toxins and the makeup and hair and the hairsprays. So the genetic mutations that can happen from chronic excessive exposure. But you have to identify what those are for you.
Thank you. Dr. Beal, you can unmute, please, and ask your question. You're muted.
Yeah, thank you for your talk. It was very, very interesting. In terms of the red meat consumption, I agree with you to a point. The point is that a lot of the red meats available to us in the marketplace have been treated with steroids and other additives, which basically, as far as I'm concerned, creates a food that is really, as you've stated, toxic to us. Now, there are present studies going on right now in the population of people maybe between the ages of 55 and 70, which are looking to see the relationship between a plant-based diet or better said, a reduced meat consumption diet and the process of Alzheimer's coming forward at this point. Because the statement is that we need we need some meat consumption to aid in our brain activity. And when we move past that, we tend to slow down with that. And that study is going on right now. The additives in the red meat you're absolutely 100% correct. We need to move past that. I'm wondering if the organic meat products, which are grass-fed, no additives, no steroids, consumed maybe twice a week, would be better. And I'm not speaking about a hamburger that's grilled or anything that's basically fried at this point. I'm speaking something that's prepared in a way that is nutritious and helpful to our bodies.
Yeah, great question. Thank you for that. One thing that I would say is the general prescription for preventing cancer here applies whenever there is chronic inflammation. So unless you know what your status is as far as chronic inflammation, you don't know how much room you have to wiggle. That's one. And second, in the frail older adult, actually they've already published studies that the higher protein intake for the frail older adult is helpful. But again, you have to negate inflammation, cancer growing and things like that. Whenever you have cancer as a potential player so far, the protocols usually, if it's going to be to help with lifestyle, going to eliminate the animal product. Now, again, overwhelming majority of animal product that is found in the country, unfortunately, is not the kind you want to be eating. So if you happen to have a small source that is going to help and not hurt, then it's a good thing if you don't have inflammation. But yes, so the other thing with cognitive dysfunction, the first papers on reversal of early cognitive dysfunction are being published. And that's actually one of the key factors there are mega doses of omega-3. High doses of omega-3 found to be helpful, and a few other things, but it's still preliminary. I'm following that because as populations age and as we're recognizing Alzheimer's and cognitive dysfunction as a pro-inflammatory state as well, this tends to make sense. That the nutritional protocols that are high in anti-inflammatory, like omega-3s, would actually help reverse some of those symptoms of cognitive dysfunction. But there's the other studies for meat in older adults. That's there. Those are studies that by Dr. Walter Longo, who looks at longevity and health span for older adults. And some eat meat, yes.
Thank you, Doctor.
Yeah. Yes.
Thank you. Thank you so much. And there are many sources of protein. It's not just meat that, adults can get the protein from, instead of exposing themselves to these chemicalized meats.
It seems that there's a time in midlife where if you grew up in this country, you might become inflammatory. It's very, very few people that are not suffering from chronic inflammation on this obviously American diet. Even so in midlife, the need for animal protein and the convergence of the poor quality of the animal protein is providing the perfect storm to fuel all of this increases, not only in heart disease, but cancers and cognitive dysfunction, Alzheimer's. So this age group between the 30s and the 60s, it's prime time for prevention or going with where everything's going right now.
I'm so glad we have a lot of late 20s and 30s on the forum tonight. So that's fantastic. There's a question here that says, are there issues getting yearly dental x-rays that dentists make you get and yearly mammograms? We took care of the mammograms already. And, like I mentioned that there are some of the colleges say you should get mammogram now starting age 50, every other year. But the College of Radiology insists that you should get it every year and start it as 40. And GYN, the ACOG, thinks you should get it every year at 40. So like you said, the physician has to look at their patient and go with what would be best for them. But what about the dental x-rays?
Yeah, that's another source of radiation. Again, yearly isn't the frequency that is clearly associated with progression to cancer. So for that individual, thinking about if you get a sunburn, it's the same amount of DNA damage. So if it happens once a year, what are you doing around the time that that's been a toxic exposure to help the body recover? That's how you prevent. You don't necessarily have to forego a test that you need, but knowing that the body can bounce back, how do you consciously put in place the anti-inflammatory things around that time that can help with DNA repair if needed? Because if your DNA gets disrupted by, a long day out in the sun, you won't feel anything, but you consciously know about this now. How much water will you drink? Will you think about how your sleep will be that week? How will you choose your foods? Will you be thinking about helping your body recover from those toxic exposures? So I think it's less about determining how many is too many. I can tell you how many is too many. When you have sick patients who are in the hospital who are getting daily x-rays, that's too many. The chronically ill patients who are getting a lot of daily x-rays just to see how the pneumonia is progressing, in that population, yes, there's been links, but yearly mammograms, the dental procedures, kind of a spot in a long span of time, maybe it may be best to think about how to mitigate that exposure. Just like you might be exposed to secondhand smoke once in a while, it could trigger a change, but what is the net inflammatory state that you're providing the body?
Thank you. So how much soy products like tofu are allowed on a daily basis?
Allowed? Well, you know, it's interesting because of Breast Cancer Awareness Month. I listen to a lot of well-accomplished other people in this field, and soy is not restricted. That's the bottom line. It mistakenly, because it is a phytoestrogen, a plant-based estrogen, was lumped into all of the synthetically made Premarin and other estrogens that had been used that were linked to the receptors really responding to that exogenous estrogen, all those chemical estrogens. Soy, if you are a cancer survivor now, you are told to increase your soy intake. It helps. So I would say, based on what your macro needs are, is what you would do. So for example, soy has proteins, it has a lot of other good elements, but when people use it, they usually use it like proteins. So in a meal, 25 grams of protein. If you use the app called MyFitnessPal and you put in, get soy that is organic if you can. If you use MyFitnessPal app and you put 4 ounces of soy or 3 ounces of soy, for females, usually 3 ounces of the protein is going to be equivalent to the 25 grams of protein that is needed per meal. So if you do 3 ounces of soy in a meal, it would be fine.
Great. So there's a question here that says, is there any connection between high MPV, and I think that's mean platelet volume, blood work, and cancer? And what is the treatment for high mean platelet volume? Adeoye Akinode, if it is not mean platelet volume, kindly unmute and ask that question.
Yeah, thank you very much, Doctor.
Thank you.
I think it's what has to do with the pellet. I don't know so much about it, but I think it's what has to do with the pellet.
The platelets. Okay. Thank you.
Yeah, so it is, too isolated a question without enough context, because the platelets, they're really big when they come out of the bone marrow, and their volume can be thought to be large, and they get smaller a little bit as they mature, so the volume gets a little bit smaller. And there's a normal range for the population that they decided was the normal population here in this country. So that question is too isolated. I would look at the context. If the platelet line of the blood products is abnormal, too high or too low, then you look at what the issue is with that line of a blood product there. It will go back to the bone marrow eventually, because that's where we produce those types of bloods. But it's not like the red blood cells where the volume gives you clues about certain vitamin deficiencies, and other physicians can chime in here. So if someone's producing more of the immature forms of these cells that are the red cells, the red cell lines, they're going to be a little bit larger. So as it relates to cancer, probably not the one thing that's going to be your, the shotgun approach or the smoke in the mirror. It doesn't tell me much unless I have more information.
Thank you. Sister Lola, yes, inflammation can be measured in the body. The question is, can you measure inflammation? That was during the talk, and yes, that can be measured by blood work. So there's another question. Does coffee intake increase the risk of cancer?
Well, how much coffee intake and what quality coffee? So I think we touched on that a little bit during our last conversation, but in general, actually coffee has some very pro-health attributes, but the way that it's manufactured here, and this is an anecdote, I grew up on a coffee plantation back home in Haiti, and my grandmother produced coffee for the village, and we had an industry where we would bring the coffee beans, they would take it, and we would, get money to do other things, and they would produce coffee locally. But we made our coffee from the plant to the cup at home. And that coffee I grew up on as a kid. I was never wired. I came to the United States. First of all, I thought it was the part that we wasted. There's the water coffee that you waste. I thought I thought we were drinking that for two reasons. First of all, it was very light. Second, it was extremely toxic tasting. I remember distinctly drinking that coffee for the first time and feeling all the acid and feeling unwell everywhere in the head. So if that's the type of coffee that you're drinking to stay awake, yeah, I think probably there's a problem. Obviously, the caffeine content was like, I'm not sure, it's anecdote again, but you have to look at, is this production for caffeine for you to stay awake? If that's the truth, then yes, I think it's an issue. It might be less directly related to cancer, but other issues. And but in general, coffee as a bean is anti-inflammatory, and it's actually healthy if you can get the right kind.
Thank you. There's a study, it's a limited study that suggests that coffee, and I don't know what kind is, I'm not a coffee drinker. It does exactly what you just said it did to you, to me, and I can take it. That coffee, though, decreases the incidence of certain cancers. I think it's liver and endometrial cancer, if I remember correctly. But it's a limited study. More studies need to be done with that, but I don't know what kind of coffee. So I guess we have to pick our coffees well.
Yeah, one thing that I would mention as far as one item to prevent cancer, in the food conversation and the lifestyle conversation, that one item hasn't made itself completely clear yet to the lifestyle community. So if you're looking for one item to help prevent this, there's a lot of them. There's a lot of items. So go with the few that will actually become part of your lifestyle and be there chronically to help, because it is not clear yet of one front runner. Someone might say the same thing about red wine, berries, green leafy vegetables, turmeric, and the list goes on. So we have to be judicious about the one shot pill or one shot item.
Thank you. Dr. Ajibade has a comment on coffee. Can you unmute, please? And while we're doing that, Dr. Ashby, can you take down the slide so that we can see you? I want to see you when you are speaking. Dr. Ajibade, please.
Okay,
Go
can you
ahead.
hear me?
Yes.
Hello, can you hear me?
Yes.
Can you hear me?
We can hear you. You're a little bit muffled, but we can.
Okay, all right. I just want to say big thank you to Dr. Ashby for this excellent presentation.
Okay.
Does that come out well?
We cannot hear you. You're talking like a robot.
You're talking like a robot.
Yeah, I don't know what's going on, but we can't hear you.
All right.
No, I'm not going to.
Okay.
Can you put your comments in the chat box and we can read it?
Okay, I'll do that.
Okay, thank you. So, is it possible for non-meat eaters to develop polyps? I'm echoing and I don't know why.
It should be okay now.
Thank
Better.
you. Dr. Ashby,
Yes. Is it possible for non-meat eaters to?
develop polyps.
Well, let me answer it this way. Yes. And how? What types of foods have been going into the colon, even though it hasn't been meat? The same question, do we have lifetime vegans who are obese and overweight? Yes. So just by virtue of not eating meat does not equal has been having a healthy lifestyle. So the polyps can still happen. Of course, there's a genetic component to that as well, the development of polyps that can be tested and the families. But comparing meat eaters to non-meat, the fiber in the plant, the fiber contents in the plant is protective. However, it doesn't mean that a lifetime vegan shouldn't get a colonoscopy. Just like you don't know whether you have inflammation, you should get tested. We also don't know whether we have polyps. And many vegans or vegetarians haven't been lifelong vegan. They might have been vegan for a couple of years. And they might have grown up eating meat. So yes, the possibility is still there.
True.
Dr. O, I have a question, but it's too long for me to type. Can I please ask?
Please, oh, please, ma'am. That's better for me. Please, go ahead.
Dr. Ashley, thank you for a fantastic presentation. I'm from Nigeria, and we are meat eaters, most of us, except Dr. O. But it's not just the meat, it's the body parts, like thrive, the intestine, and the tongue, and all of those things. And I'm hearing some people saying, okay, the tongues, the intestine, the tribe, they are not red meat. Is that correct? Or is that, does that have same toxin as the red meat would have?
Okay, I'm glad you brought that up because we can help to clarify. When someone says red meat, let's say we're talking about beef, we're thinking maybe it's just the muscle. No, it's the animal from which it came. So if we're looking at the tongue or a different body part, first of all, we're talking about a different place that may not have the scale of the farm-raised animal conditions of eating grains and getting fed certain things to keep them healthy, hormones to get them big. The production that exists here, if you guys haven't had a chance to watch some of the popular movies about those, maybe, that will give an idea of the scale of production needed to feed a country. So the farm life of the animals is what leads to the animal causing disease in us humans. If in your environment, that type of scale isn't like that, and you have a small family farm and you know where your animals come from. I grew up on a farm as well, and we had animals and we ate some of them. Everybody was lean. Nobody was obese. So there are certain signs that present themselves when the human body is beginning to encounter trouble. One of those signs is obesity. If obesity exists, likely there's chronic inflammation. If chronic inflammation exists, possibly there's a polyp if you look. So just know the facts first for the body. If you're at that age where you can get the appropriate screening, and then work backwards and see, based on your risk, what are you able to eat? Based on the animal production locally, how are you going to make those choices? So that, again, it's not eat the tongue, you'll be fine, avoid the liver, that can cause cancer, avoid the red meat only. So chicken in particular, let me get on the white meat. Chicken here in this country is one of the most toxic entities. Why? Because of the way they are raised and fed and treated. So what you have to look at is, what is your environment and where is the food coming from that you're directly putting in the body, in the tube that has direct access to it, and then seeping into the cells that then has to deal with whatever it is that was in that meat. So in general, animal products consumed over time, and by the time we're 60, we've had enough consumption of it, the human body shows certain signs, whether it's obesity, inflammation, or polyps. That's what they're linked, those things are linked back to. So I can't really break down whether the tongue is better than the flesh, whether the tongue is not considered red meat because it's not the muscle. Typically, we talked about red meat based on the different types of animals. So, if you're eating the tongue, it's still animal. If the person that's eating the tongue is already inflamed and has the physiology of not being able to reverse genetic mishaps, then more animal product will cause more inflammation. So the prescriptions are more sort of enlightening. Sit back and think about what the environment is that you're bringing inside, literally bringing the environment inside. And maybe in your environment, eating meat may not be as toxic as eating it from where, I might be sitting or Dr. O might be. So knowing where your food comes from and what's in it is very, it demands a lot of responsibility. But that's how you take your health in your own hands.
Thank you very much. Does goat meat make a difference with cow meat?
Yeah, well, I would say same thing. Where is the goat raised? It's still red meat. Which colon is it going in? Is that body inflamed already? Does the body that's eating the meat already know that are they good? No inflammation, no polyps? See, that personal responsibility piece about not eating unconsciously has to come out. So you can always make that personal choice. Not out of fear, but out of curiosity and out of interest in your health, finding out what is my actual state of inflammation. It's easy to measure. We know it's linked to so many different diseases. Why don't I find out? And then second, what am I eating on a regular basis that could be keeping me inflamed if I am inflamed? And then making the food choices based on that, as opposed to a blanket prescription for everybody. But goat meat is red meat.
All right, Dr. Ashley, thank you.
It's not an easy pill, right?
No, not at all.
But
But good
it's a
point.
journey. It's a journey. It's just, we're learning more and more so that there's less and less surprises because we see where the trajectory is going, at least for the United States. Unfortunately, worldwide too, wherever it is industrialized nations.
Dr. O, you are muted. Dr. O, you're muted.
Thank you. I had a personal experience early this year when we went to South Carolina, and we went to, I know my sis is on here. They have a farm. They raise their own chicken. So they give us some chicken to bring home. I don't eat chicken anymore because, I mean, look at the chicken. In between the skin and the flesh, fat, it's loaded yellow fat. It's just incredible. And we know what goes into it, the antibiotics, the, all whatnot, and, and the hormones. This chicken had zero fat, zero, between the flesh and the skin. I'd never seen chicken like that, not even in Nigeria. I was blown off the water. I don't know what my brother is doing, but he's doing phenomenal work, raising authentic organic chicken. I think that makes a difference when we're talking about these toxins.
Yes, it does. And I'm so thankful for people who remember what it was like to have normal animals, because that chicken that you described, a little bit tough. The tissue, you can see the striations of muscle. It's a little bit tougher. We call that country chicken back home because we know that's the difference between the ones that come from your local neighbors versus the one that you get from the other country, from the United States, for example. So that's you eating that. So
thank you. So I have a question here, and I know it's a huge topic, but it says, how often should we fast and for how long?
Okay, fasting is a prescription. So it really depends on what the person doing it is trying to accomplish. For longevity and general wellness, we fast every day. We fast from the time we finish dinner to the next day breakfast, right? So after dinner, we have to make a bunch of assumptions. Assume that your dinner is digested. Assume that your blood sugar after going up has gone back down to normal. Assume that there's no insulin resistance that will make your insulin stay up way after your dinner has been digested. With all of these assumptions in place, you supposedly ate something and 2 hours later you are back to normal, and then the fasting begins. The fasting begins at that time, all the blood that was in the gut is then diverted to other places and other mechanisms are getting taken care of. The body's in a state of rest if you're sleeping and you actually in REM sleep and you getting restored to sleep. At that time, finally, it begins to help you out. Scavenging poorly formed proteins, getting at those 2 cells that decided they wanted to become rogue cells, abnormal protein folding, DNA damage, all of that work that's supposed to be happening when you're done, you don't need your system to be doing anything else, including digestion, is happening. That's why fasting is so important. But if you're going to sleep after having dinner, your blood sugar is still high because you're insulin resistant or you have prediabetes and you didn't move after dinner and your insulin is still high, you're still in a pro-inflammatory state the entire night instead of getting the benefit of fasting the entire night. So if someone is thinking about fasting, get some guidance. There are a lot of great books out there. The Fasting Method by Dr. Jason Fung is a really good one. If there's disease that you're fasting for, it's important to do it in partnership with a healthcare worker who knows what they're doing, especially if the person's on medication. So fasting happens every night. You have the opportunity to improve the quality of your results from fasting, if you're not in a high insulin state during that time, and if you extend the morning time or you start earlier during the evening. Whether you extend the morning hours or begin fasting earlier is usually a matter of lifestyle and habit, but both are helpful. If you eat dinner earlier, that correlates with more longevity. So it's actually, if you don't mind either one, ending dinner a little bit earlier by 7, it correlates with longer health span. But having a shorter time total that your body is exposed to food where it's having to digest and do all this metabolic work and not helping you cure your starting cancer is important. So keeping that limit of my whole system is directed at digestion, maybe for 8 hours a day only, would be great if you can get to that. But it usually is a gradual progression to fasting 12 hours and then 13 hours and then 14 and then 16 hours.
Fantastic. That's my bro from California. Is your question answered, sir? Mr. Taye Dogati.
Yeah, that's correct. Yeah. Thank you, Dr. Ashby. Great presentation.
Thank you. So at what age is pap smear done? Or should it be done?
That's a question for you, right, Dr. O?
Okay, that's a question for me. Before, we used to start at the age of 21, or when somebody starts having sex. If you start having sex at 12, then we start pap smear at 12. But that standard had changed. Now, sorry, at the age of 18, we used to start at 18 or when you first start having sex. Now the standards have changed to starting at 21. And so that's when it starts. We don't start.
Yeah, the sex part, HPV, the human papillomavirus, is like a sexually transmitted virus. And so that's why the whole point of checking the pap smear is to see if somebody has that. And they would only have it if they've been having sex and had been exposed to somebody with HPV or any other viruses. And if we talk about HPV being there chronically for 10, 20 years, if it goes unchecked, that environment can become cancerous. So that's the importance of the pap smear. Don't let it slip.
Exactly. But now we start at 21, regardless. So at what age should we start and or stop having colonoscopy to determine cancer? Dr. Ashby mentioned that before we used to start at age 50, or depending on family history, we can start earlier. If somebody has a first-degree relative has colon cancer at a particular age, say age 50, we will start screening in that relative at 40, was what we did, and we still do that. But now we don't start colonoscopy at 50 anymore. Colonoscopy has been decreased to 45 because we're seeing the incidence of colon cancer earlier in people. So the age you stop, we screen, it depends on the doctor. They say screen to 70, we can push it to 80.
And the colon cancer is one of those preventable cancers. Yes. Completely preventable. If the polyp is there, it's taken out. If you tend to form polyps, look into your fiber, look into the meats that you're taking in. It can be prevented. So this is one of those that shouldn't be ignored because the procedure is so annoying. You have to take a terrible prep. We all get there very quickly. We don't realize, oh my goodness, I'm in mid-40s already. Colonoscopy, oh my goodness.
I know. And I don't know why in our population, people are scared of colonoscopy. Please, it is an easy procedure. You don't feel it. You sleep through it. It's only like 30 minutes, if that. The difficult part of it is prepping. We talked about that last week. The laxatives you drink or take to clean out so that your colon is clear for the doctor to be able to see in there. It's a cure if you have polyp and it's removed. So please, let's all get colonoscopy when we're that age. So Auntie Tawa, go ahead, ma'am. You have your hands up.
I guess I still have to go back to the question I asked about pap smear. What age do you stop having pap smear done? I didn't. You said you start at 18. When do you say no more?
At 21.
No, when you are done, that you don't do it.
Yeah, stop. When do you stop having them? So and Dr. O, you can chime on this, I guess, because there's some flexibility there depending on if they check for the virus HPV and the virus is not there. Let's say the woman is 65, and nowadays 65 is young.
Mm-hmm.
So the woman is 65.
Got that right?
Yeah. So woman is 65, and you check the pap smear. There's no HPV. Usually we say, fine, you're good for 5 years when there's no HPV. Kind of like when they check for the colonoscopy and there's no polyp, you're good for 10 years when there's no polyp history. Same thing with HPV. So you're good for 5 years. Now, if it's a young, sexually active, 65-year-old, I'm going to check again in 5 years. But if there's no introduction of that HPV from any place, then there may not be a need to check if the history has been negative for HPV.
Thank you.
Okay.
So it's individualized. Dr. Damien Dublin, you have your answer. Kindly unmute and ask your question. Thank you.
Yeah, good evening all. Let me thank Dr. Ashby for this presentation. And the way it was presented, easy to follow. Even somebody who may not be right in the medical field could pick up from there. My question is, are there studies done, or is it a myth that the melanated skin is a protection against skin cancer?
Well, I don't know how you want to define myth, but I want to mention that melanated people do get skin cancer. Mm-hmm. So that's a fact. And if we look at the cancer rates, men get more of that skin cancer than women. And it's directly related to DNA damage from very high and toxic exposure from the sun, which is why the dermatologists, they're right when they say, do wear protection from the sun if you're going to spend a lot of time out into the sun, especially at certain hours, depending on where you are, near the equator. So I guess it's a myth then if people say melanated skin doesn't get cancer, because they do. So that answers the first question. Now, melanated people also have too little vitamin D, right? And you need the sun. So everybody's looking for the simple answer here, and the answers are too nuanced because we don't realize the complexity of the machine that we're down here playing with, this human body, this human mechanism. You need the sun, but too much of it will also cause some types of damage. So what's the right balance for you? Well, try to avoid the high noon sun, obviously, right? Because you don't want to get burned. The burning is damage. So all those people who are getting sunburn, that's an opportunity if it's not regulated, if it's not appropriately repaired. That's cellular damage, the sunburn. So don't get sunburn ever. There's no need to get sunburn to get appropriate vitamin D. But the vitamin D, if it's deficient, you can't get enough sun to fix that. That has to be supplemented. It's a hormone. So if the vitamin D is deficient, just like if B12 is deficient, you have to take enough to get it to a normal level, and then the sun mitigates the rest that you need. There's a certain amount that you can get production of on a daily basis from your sun exposure that will not get you out of an empty tank. So I hope that answers it. Melanated people do get skin cancer for sure. And actually, because of the maybe failed thinking of they're protected from the sun, maybe unknowingly allowing themselves to have excessive exposure and even sunburn. Sunburn is harmful to melanated people, just like it is to anybody who would get redness that can be seen. It's the direct damage with all of the downstream cellular activity happening underneath the sunburn.
Yes, I just want to echo what Dr. Ashby just said. Black people can get, and they do get, skin cancers, but not as much as Caucasians. However, when you look at the skin, the Black people, we actually recommend that Black people should wear sunscreen, just like white people. When we're going on vacation, we take sunscreens with us and we put them on. You need to protect yourself. Supplementation of vitamin D should be by supplementation, taking the pills like Dr. Ashby said. Exposure to sun, especially between the hours of 11 a.m. and 3 p.m. is not advisable. And even after that, how many hours do you want to sit in the sun daily to get the required vitamin D? I don't know. Do you know, Dr. Ashby?
Well, yeah. So if there's deficiency, the sun exposure will not treat that. Assuming there's a good amount and maybe you're close to goal, exposing enough of the body for enough time is the ideal. So enough of the body. The face, enough? No, that's about 8 to 10% of our total body exposure. The back could be another 30%. If the chest is exposed, that's good. That's about 50%. So 50% for at least 20 to 30 minutes for melanated people. That's like going out at the beach. That's the amount of exposure that's needed in the skin and for the duration of time, 20 to 30 minutes, to allow that reaction to happen without burning. Depending on the sun, the latitude, how much you're getting of that sun, less time is required. So let's say it's a little bit later in the day, 6 p.m. versus 10 a.m., you'll get more sun at 10. So you might need less time. Of course, with less melanin, less time is needed and less exposure of the skin is needed. So it's such a beautiful thing, our mechanism. It's really not that simple. But if you haven't been out in the sun in a while, think about it the next time you're there. If you're taking a walk and your cap is on and your clothes are on, you're not getting enough exposure to get that vitamin D reaction on the skin for enough time for it to make a difference.
Thank you so much for this explicit. Thank you. So for prostate cancer, please discuss radiation treatment versus chemotherapy. Mr. Doherty asked that question.
Wow, I'm not even going to step into that.
That's a lot. Okay, radiation versus chemotherapy.
That is so loaded. Obviously, I'm not an oncologist. I don't discuss them with my patients. I help my patients so prostate cancer is extremely common. It's the most common in men. When we talk about male cancers, female, it's breast, prostate, it's guy. So, and it's a big decision tree for them. Am I going to get surgery? Should I get radiation? Should I get these inserts? Where should I go? I help my patients focus on what are you as a host? What do you look like as a host? What is actually your inflammation level? What do you eat? How did this cancer take root in you? And where are you now with this? Because whatever modality you choose, you still are a sitting duck if the setup that got the cancer is still there. Not only that, how you progress through the treatments, whichever one you choose, is determined by how the host is, what mechanism you are supporting in the body for healing. So the choice of modalities is such a personal one that I would never, nobody would really be able to say which is better, which it really depends on the case, the invasion, the grade, the person's lifestyle, some of the side effects from surgery with prostatectomy. Do you want to have those with radiation? Do you want to have those? It's a very, you need a really good healthcare provider to do that march and to look at the risk and benefit of each pathway. But more importantly, how are you going to support the health equation portion? Not just the disease, or what am I going to do with the disease? But the whole big side of it is the health wasn't there. That's how the disease became the paramount issue. So how are you going to get back to supporting the healthy part of the equation? How do you support the health through the cancer and beyond the cancer?
Excellent.
I'm sorry, it's not a very satisfying answer because it's not clean. And it cannot be clean by virtue of not knowing all of the information. And I go through this walk with my own patients, and I have to start there. I have to start back and show them what body they hold, what's the health of that body, what allowed this cancer to become home, let their home. And do you want to take care of those things? Okay. And if there is an issue, we have an invader, it has to be taken out. We look at the pros and cons of each way that you have to cut those things out. Just like we have to take out HPV and the polyps, once they've grown, you have to do something about the intruder that's been allowed to propagate and multiply. But the choice is going to be ultimately yours on that one.
Yeah.
Thank you.
So there is something really similar to that. How often should one get colonoscopy after a polyp is found but benign?
Yeah, the gastroenterologists make it very clear. They sometimes personalize it too, but they definitely like to see you before 10 years, any kind of polyp. So that's going to be 5 years out. And depending on the type of polyp and how things look and how many, they may have you back at 3 years. But the gastroenterologists are extremely good at saying, I want to see you back in 3 years versus 5 years. If there's a polyp, you have the setup to create more polyps. You also should look at, why do I have a polyp? Why do I have a body conducive to creating polyps? You created a polyp, and that's an inflammatory state. So always look at that. The polyp is out. Now what are you going to do? You had a precancerous situation, possibly. Okay, they say it's benign, but it was polyp and it needed to be removed. So maybe you have an inflammatory state that has to be dealt with.
That is key. Dr. Ashby, you just said you have a polyp, it may be benign, but it has to be removed. See, if the GI doctor, the gastroenterologist would rightfully decide if it's 3 years or 5 years to come back, even when it is benign, meaning at that time, they didn't decide that it was one that would cause cancer. But if this were to be in the uterus, Dr. Ashby, what is the recommendation? Take it out.
Yeah.
Take out the uterus if you are not in the childbearing age anymore, because the polyp will grow back. That's what they do naturally. So if you're no more in the childbearing age, you take it out. That's standard. Screening, prevention is always still the best. A follow-up question to that, Antitawa asked again, if you are type A personality, are you prone to cancer?
Well, high stress, I assume that's what type A is. There are a lot of type A people who are overachievers and manage to be very level-headed. I mean, that's a very personal question. I know a lot of overachievers who are not stressed. So the question is, if you tend to stress yourself, are you putting yourself at risk for cancers? Yes, you're putting yourself at risk for anything that is in that realm of dis-ease.
Exactly. Thank you. Thank you. So this is a personal question that was sent to me. Can you give some advice for a friend who has just been informed by his doctor that he has stage 2 cancer, stage 2 prostate cancer? Apparently, he has an aggressive form of cancer. He is in his late 50s. Can you please advise on that?
So anytime there is cancer already there are serious decisions that have to be made. Ideally, you want to eliminate the existence of those abnormal cells in the body somehow. And right now, conventional medicine has many ways, some of which people will call toxic, of removing those tumors. The naturopathic world also has its own modalities for helping people with more choices. So assuming you have a walk and you plan on taking action to have a tumor-free body, that walk will always involve lifestyle. Paramount and very pressing is what to do about the tumor. But the larger picture is, how did I get here? And I don't want people to forget about that portion of it when they're so, focused by the pressing timing of the situation. Again, in this case, prostate cancer is very common in men. And I'm very sorry about the diagnosis. I always step back and say, this is what I would say to a family member, is look at all of the options and what the options can do to your lifestyle and which you are willing to take, because at this point, an action has to be taken to get rid of the cells. And then more importantly, assuming you want to be a survivor of this, what is your lifestyle going to look like as a survivor? I know many prostate cancer survivors, and they look very different in life than they did before the cancer, as far as the lifestyle changes that they've made that have helped them remain cancer-free. That's the more overarching message. The difficult decisions are now about radiation versus chemo versus, completely natural, which is itself radical. But lifestyle can happen with any of the modalities you choose.
Thank you. That's a tough one. And it has to be, treatment is always individualized. Those are difficult questions to answer, but you handle them all the time, Dr. Ashby, like a champ. Thank you. So Dr. Bill has this question in two folds. Many prostate cancer treatments require 44 weeks of radiation, of course, to kill the cancer. But what of the secondary effects regarding the microbiome?
Well, those are the things that you want to weigh when you're deciding which way you're going to go.
That's
Do you
right.
want to stand with the potential long-term effects of radiation, which can affect every structure that's in the vicinity of the radiation, not just microbiome, but even structural integrity issues with radiation and adhesions, for example, versus surgery, which can lead to impotence depending on how aggressive and where there's invasion. the margins and all of that. So the lifestyle with the options has to be weighed heavily with the oncologists and the urologists that are involved. You know, it's a very, very, very tough choices have to be made once you're there. And someone asked a question about cancer in children. Well, we talked about 40% of adult cancers being preventable with simple, you know, simple lifestyle measures, becoming more conscious. While obesity in children is rising and causing all kinds of adult problems, many cancers in children have nothing to do with lifestyle, just like many cancers in adults have nothing to do with lifestyle. So that portion of the cancers is still there and is a very difficult thing to deal with. And, you know, you have to go with modalities that are proven to help put people in remission and cure for those. But we're trying to eliminate the chunk that you don't have to deal with, like all of these prostate, colon, breast cancers, 40% of those.
So what about a woman being treated for some kind of bone cancer? The question is, should she be on birth control pills, oral control pills?
Oral contraceptives have been tied to breast cancer acceleration in some cases where the birth control has synthetic estrogen in it, and that whenever there is female breast cancer that feeds on that type of estrogen, it's in its environment to get fed and to get blood supply and to grow. So the caution with oral contraceptives is it increases the estrogen, the synthetic estrogen environment of the female body. And we know that excessive exposure over years, over time, is a risk factor. And that can be in somebody who had their period very early and had shifts in menses and hormones all of these years, who didn't have any pregnancy, so who didn't have a break from the shifts, and then continued on, to menopause, never having a pregnancy. There was more exposure in that lifetime. Whereas somebody who had, early pregnancy and had a break for multiple pregnancies didn't have that much exposure. So the hormonal effect relates more specifically with breast cancer, because some breast cancers do feed on estrogen. And when we introduce the estrogen through synthetic means, it's usually a very high amounts that the body doesn't produce, and it's not identical to what the body produces. And so we have that risk. It's good to think about that. But bone cancers, I'm not sure as far as the oral contraceptives and a bone cancer. Any cancer in general is an invasion of abnormal cells. And if you think about how you can improve the environment to help it repair damage, it applies for all cancers. Okay.
Muted again. Thank you. What effect does MRI have on our cells in relation to cancer?
Yeah, that's another exposure by X-rays. It's the same conversation we had earlier. Occasional in the lifetime is not an issue. Occasional, there's an issue orthopedically or, with the breast that needs to be seen with an MRI. Those aren't the cases that are, we try to look for the little things when, we spend so much time blasting lifestyle. How about the burger I ate yesterday? How about the fact that I haven't had 40 ounces of water in any day ever? How about the fact that I sleep, I wake up tired, I might have sleep apnea, but I don't want to deal with it. How about the fact that, 3 meals a day, every day, I don't even know if I'm insulin resistant. The elephants in the room are almost never talked about, but we go to that rare MRI and think it's the one that's going to kill us. The things that are killing us, those 40% preventable cancers, are happening with things that you're doing every day, that you did today, that you're not aware of, that you're not conscious of. And I'm part of that too. So it's waking us all to those meaningless things that we take for granted. When we suddenly get the diagnosis, then we have to go back and add it all up. We have to go back and try to add it up. And it's small, it's insignificant. You know, you didn't exercise. I don't know how it happened. I never had a chance to in 60 years. So probably those are more important than the MRI.
I agree 100%. Some radiologists are calling for the use of MRI in breast cancer screening because MRI uses magnetic field. And that's why if you're having an MRI, they would ask if you have any metals in you. You know, you have to take off, you know, all these metals. Or if you've had surgery that that metal has been implanted in you, because it uses magnetic field. So it doesn't expose you to radiation. You don't have radiation there, and they're calling that you can actually screen. You can do that yearly mammogram with MRI, but insurances are not covering it. And it sees more, the MRI sees the breast more, which leads to another question here. The reason I actually, mentioned that is because somebody is asking for advice on what to do when a woman has dense breast.
Yeah, I saw that question. That was, that's
Auntie ABC from Chicago.
Yeah, that's a good question. So very close surveillance is what I would do, because the mammograms tend to be less definitive when the breast is dense, especially the radiologist has to be experienced at reading it. And they may say, come back sooner. They may say, get an ultrasound, which is another thing.
Or use MRI.
Exactly. Yes.
MRI.
So we have some women whose breasts are dense and they say, I'm going to go for the ultrasound. I don't need to, because they automatically revert to the ultrasound when they can't tell on the mammogram. So for breasts that are dense, I would want a better image.
If the insurances usually cover it when, it's dense breast. You've done mammogram, it says you have dense breast, then they will cover the MRI. And there's no additional radiation exposure. But like Dr. Ashby said, we need to take responsibility and change the needful. Instead of looking for all these other things that are outside things, we need to change the way we eat, exercise, and, just do the best thing and the right thing for our bodies. So Flo is asking if it's good to do colonic irrigation. Does it help?
I saw that. So it's important for the colon to stay clean. Yeah. Do you need to do irrigation for it to stay clean? So, well, what are you eating that it needs to be irrigated from the outside? Oh, why is it not transiting normally? Where's the fiber in the diet? Where's the water content? So if that were happening normally, the colon would be clean. It's important for the colon to be completely clean daily. And occasionally it is helpful. Someone asked, for long-term fasting, is that something? If you have a lot of fluid intake and your stools become fluid, and that happens occasionally in your lifespan, let's say a couple of times a year, you've given yourself the colonic irrigation. So not something that would be prescribed as a way to maintain health, but on the same token, it is important not to let toxic waste sit in the rectum, in the colon, getting reabsorbed into the bloodstream. So it's important to maintain that that area clean. And if there's an issue with transit, with maybe nerves causing slow transit from other issues, then it might become something to discuss. But for the regular person, it's not needed if you are able to eat appropriately and have regular stools up to twice a day, every day, then you're getting clean.
Fantastic.
If that's not happening, look at what you're eating.
Yeah.
Maybe look at the content of the fiber, the roughage, the green foods, the water, and the movement. All of those help.
Yeah. So going back to coffee, Dr. Ajibade, I'm sorry that, his mic was not working well. What he said about coffee. Coffee has a lot of protective chemicals called polyphenols.
Mhm.
Polyphenols. And there are studies that show that coffee drinkers are protected against chronic diseases like dementia and cancer. But I totally agree, he says, with Dr. Ashby saying that the commercial way coffee is processed today makes it toxic. And he says he personally drinks organic coffee.
Mhm.
So for coffee drinkers, that's some good news. So does persistent indigestion and hard poop lead eventually to colon cancer?
Well, first, why don't we skip the lead to colon cancer? There's persistent indigestion and there's hard poop. There's a problem already. So I would deal with that before it leads to something. I wouldn't wonder what it leads to. I would deal with it. And my answer is yes, chronic disease that is not addressed will lead to something worse. Whether it leads to cancer or not, it depends on what is it in the chronic reflux, chronic GERD. If, as I mentioned, it involves the presence of H. pylori that is not tested, that is never treated. Yes, that's been linked to cancers by way of something called Barrett's esophagus, where there's transformation of the actual cells that line the bottom of the esophagus. And then if you don't check that, it turns into cancer. Same thing in the colon. If there's chronic constipation, you don't have a way of pushing through the material, there's not enough fiber, we know that that leads to, or is a predisposing factor to colon cancer and polyps. So these are already disease states. We have the opportunity and the luxury to have symptoms that are manageable that we kind of take for granted when they're not stopping us cold with a major diagnosis and keep getting our attention to make hard decisions. When they're small, it's responsible and a good opportunity to honor the body and address them, even if they're small. Those, to me, those aren't small problems. Constipation is a big problem and GERD is a big problem.
Yeah. Yep. So another switch. I want an answer to this one. I don't know. What is your view on nail polish preventing us from getting energy from the sun through the nails? Vince says he or she heard that the sun hitting the nails directly is a good source of energy.
Well, I know we have a couple of healers in the room. Simone Gazandi, who's there, she's a nutritionist and a healer as well. I'm gonna take a stab at it, not actually from a scientific perspective. So the nail bed itself, when we press on the nail, so we have capillaries underneath the nail, and that tissue is active. So let's say you have an infection there. If there is a fungus, it can stay there. And so it can find nutrition, but not from the sun necessarily, but from the actual bed, the blood supply that goes there. Some people may say that the nail, like our hair, is cuttable without pain because it has, it has kind of died. It's part of what we're shedding, part of the skin that we shed that we don't have it. So to me, this is more of a minor issue. When we just talked about the sun and exposure of the skin, the chemical reactions are happening on the skin with the sun. And that's not only studied, but well-known and identified chemical reactions. And we don't even have to go woo-woo energy with that. So your skin is good. After the skin, the palms. When you talk about energy, energy is transmitted through the palms. So if someone is putting on the hands and healing someone else or receiving healing, you put your hands like that in church, it's because the energy is transmitted through the palms. So if you have nail polish on, it's okay because it's facing the other way anyways. That's my take on that. Okay, it's very powerful here, the palms and the soles of the feet in terms of energy reception. And then the skin, of course, for the sun. But I don't know if anyone else has some intake. So now the nail polish will block the reception of the waves of blood. Okay, when you put on a pulse oximeter to get the pulse, and it happens to be reading on the side of the nail, and the nail is coated with a polish, that has to be removed. But it can be read on the palm side as well. So yes, if you put the nail polish on, you get less reception, but it's by way of the technology that can't penetrate that color. That happens sometimes in the hospital.
This is Vinci. I was just told that nail polish is not good for us. I mean, stop putting on the nail polish is not good for your health. So I just wanted to, have an expansion on that. So thank you. I don't wear nail polish anyway, but, I see a lot of people always every weekend, every other week, going to get their nails done, and it's not healthy for us. So thank you.
The toxic exposures happen on a regular basis when you go to a nail salon by inhaling some of the chemicals that are being, when they're treating other people, and you walk in there, sometimes it's very noticeable. And that's why chronically they know themselves they've had to wear masks. They've been wearing masks for a long time in that setting because they realize how toxic. So also hair care, hairdressers who have had a clue have known this for a long time, 10, 20 years in the field, and they get asthma or COPD because of inhaling fumes, toxic fumes. So it is very true. Those chemicals aren't as regulated as the foods that we eat, but they do affect us in various ways.
So after putting on the nail polish, beyond inhaling the toxins, are they harmful?
After putting on the nail polish and inhaling the toxin?
No, after, say they wear masks so you don't inhale the toxin. Is the nail polish harmful on the nails?
Oh,
themselves?
If there's absorption, it's falling into the idea of makeup being toxic as well because of the way it's produced. If there's absorption, then yes, it's small amounts, but chronic over time, then that's how some people get their breast cancer, and they've talked about it. So toxic exposure that is absorbed, because our body is our environment, our body is producing what we have put in it. And so those small exposures over time can add up. I would put that in the toxic exposures category for skin, makeup. Yeah.
Thank you so much for that question. And thanks for the answer, Dr. Ashby. So Alicia says she's 61, but at 50, she had polyps removed from her stomach. She has never been told to come back for follow-up. Should she have a repeat endoscopy?
Yeah, stomach polyps are a little bit different. They're not like the colon polyps that are very reliably reproduced, especially if they're in the same environment, lifestyle stays. That's why they call you back every 3 years, every 5 years. You're doing the same thing, it's going to come back. So the stomach polyps are different. They are rarer. So in those certain foods, obviously predisposed to stomach cancers, usually when they do, it's not always by way of polyp formation. So that association there with polyps there being precancerous and being a way to screen for stomach cancer hasn't been established. So that may be why you weren't called back. But if there is any issue of chronic GERD, acid reflux, hiatal hernias, anything at all related to acid production and mismanagement, I would have a low threshold for, checking one more time, assuming you want another 20 years without having to worry about that.
Thank you. So somebody asked the question about microwaving plastic. I was trying to look at that question again. I did see it.
Yeah, I noticed it too.
Microwaving food in plastic.
Yeah. Unfortunately, it's that small dose accumulated over time. Most plastic now is BPA free, but that wasn't always the case. And so we had a lot of chemicals leak into our foods during the microwaving process. And that was one of them. I personally switched to glass because as a bodybuilder, you would have meal prep done, 3 or 6 meals a day, every day that you're microwaving. So a lot of exposure to that potentially. For somebody who's rarely using plastic and microwaving, maybe just transfer it to another plate when you're microwaving it, because we do know that plastic does leach when it gets microwaved, and you don't want to be inhaling too much of that or ingesting.
Thank you. So Dr. Bill actually reminded us that regarding, things that we put on our bodies, we did talk a few weeks ago about deodorants, aluminum base that has been implicated in breast cancer. So yes. Yeah, he just commented on that. Thank you so much for bringing that up. And he wrote, microwaving food in plastic is a definite no.
When you know better, you do better. When we didn't know, we got the cases, and now that you know how they happen, you can avoid you can prevent the ones that can be prevented.
Yes, thank you so much. There are so many comments on this forum tonight. Just thanking you, appreciating your impact tonight, and Jennifer Jones was here, and she wrote, thank you for sharing how lifestyle and fresh air, food and exercise is preventive and beneficial to cancer care and treatment, and wrote suggestions about water, but there are so many thank yous and appreciation. Thank you so much. This has been awesome. And this is just a scratch, because you have to come back and then expatiate and dig deeper for us.
Yeah, I think when people are actually on the path of lifestyle, I do get different questions. I get questions that are specific to foods differences because they're actually implementing the foods. And if I had to recommend a book to start with, Dr. Greger, I'll put it in the chat, wrote multiple books, but one of them is How Not to Die from Cancer. I'm going to try to send it to everyone. Okay, I've just put it in the chat. When you are on a path of lifestyle, you run into certain roadblocks, and the questions do differ once you're in it. And I encourage everyone, myself included, to, the next 20 or 30 years, to begin to think about the lifestyle more on a daily basis. And we can learn more about the foods and what's really great for this and what's really great for that, because that's where it is in terms of medicine for the future as far as primary care is concerned and prevention. If we can learn more about the foods that we talk, not just avoid this, avoid that, and avoid that, but when we start thinking about, okay, so then what am I going to eat? The questions that we interact around are a little bit different and a little bit more fun. And actually, we learn a lot from each other. Do you get organic strawberries or do you not? How do you get your omegas, or how do you get your B12? Incorporating things into the diet becomes the project. So it's a little bit more directed.
Fantastic. Mm-hmm. Thank you so much. There's a question here. Sister Lola said she has a yearly physical scheduled for tomorrow. She's fine. What are the must tests she should request for?
A yearly physical scheduled for tomorrow. So probably, in the yearly physical, people usually get a complete blood count, the basic lipid panel, the cholesterol panel, of course. And those are all fine, but they look for already failed organs. So if your liver is failing, it will show there. If your liver is inflamed, it will show there. If the kidneys are failing or it's not filtrating as much as it should, it will show there. So organ dysfunction is what we catch on these yearly physicals. And in the cholesterol panel as well, if it's too high and high enough to get a medication, you will be told. So I think our physicals are missing a lot on the health side, but it's looking for disease after the disease has already happened. And unfortunately, it's not going to help you get healthier. It's going to tell you if you've got something that needs attention, and then your attention now. But the things that I would recommend, that I recommend for people who come to me, and I don't start their care until I know these things, is the cardiovascular health. What does it actually look like in detail? Because that's the number one killer. We heard prostate cancer a couple of times here today. If we talked about cardiovascular health, we would have a lot more examples. So I look at the detailed cardiovascular health with an advanced cardiometabolic lab test. That is available, but most doctors aren't doing it because it does take time to interpret it and then know what to do. What are you going to do about it? It's all nutrition. And so again, the doctors there, that's not their job right now. So I would look at that. What is the actual I find disease in most people who think they're healthy at 60 something. And it usually has to do with cardiovascular, metabolic, or inflammatory state. Those three are what I would look at. And unfortunately, we're not there yet where every doctor is doing all of those tests. But if the cholesterol comes back high, or the livers have a little bit of inflammation, there's reason to go back and do those advanced tests, and have them covered by the insurance to look for a disease that is in development before it's too late.
I would add checking the urinalysis. There's so much you can learn in the urine. The kidney function can. They said that some people have urinary tract infection and don't know, and and blood in the urine, something like that, which would talk about the health of the bladder. Also, vitamin D, checking the vitamin D level. A lot of doctors are not doing that yet, because when we say supplement with vitamin D supplement, sometimes when you know that you're deficient and you know what deficiency would cause, then it helps. To be adherent to such care. So things that Dr. Ashby would check is not standard that we check. Unfortunately, we have a lot as doctors to learn in medicine from the lifestyle medicine physicians. And I hope that, we continue this learning and incorporate more things into our practices. But those are the things you should check tomorrow. If you have not had pap smear done, you should. You should do your mammogram. If you haven't, it depends on when you started colonoscopy, or if you haven't, you should have colonoscopy done. So get referrals for these things, you know. If your primary care doctor does not do the pap smear, you should get, you know, you should find a GYN that does it. Hit me up, I'll hook you up. So if you had colonoscopy over 10 years ago, or, you know, you've never had it, like I said, please get that done. I think, you know, those are the things that I would add from the primary care platform level.
Yeah, and I think more doctors, prevention cardiologists, for example, are doing some of the testing that I talked about, and looking at nutrition, for example, with vitamin D. It's hard to get that covered sometimes, but it's a work in progress for us as a field. But it's good to have that question.
Yeah, I actually got a letter from Medicare one time. This was a couple of years ago, that I'm ordering a lot of vitamin D.
Yeah.
Older folks. And I looked at it, I'm like, okay, so what should I do with this? Because I really don't know what to do with this. And I think Medicare has caught on, because places like Johns Hopkins, I think some other I know Johns Hopkins has been doing a lot of research on vitamin D, and a lot of things we know now comes from there. I think Mayo also, and some other places. So that has been helpful. So here, First Lady Judith Mitchell said, thank you very much, you know, and she thanks God for your wisdom. We have Herman Irish from London, the 5 hours ahead, and is still up. He said, God bless you, Dr. Ashby, Herman, London, UK. And Mr. Yomilawal, my big bro, said, Dr. Ashby, you are phenomenal, not only for sharing your outstanding knowledge, but also for devoting so much time to answer every question so diligently. God bless you. And you too, my sister.
I receive it.
Amen. I received that. I had to read that. You know, I appreciate it. Thank you for blessing me too. And you know, it deeply appreciates these sessions. Thank you. Mr. Simone Gisondi said,
oh, that's Miss Simone.
Miss Simone.
It's a she.
She's
actually in Sarasota with me, and she's a trained nutritionist with background in cancer care.
Remember, I listened to her, and we're bringing her on Medical Mondays. She doesn't know yet. Remember, I got that information from you. She said, amazing presentation. Thank you for being so generous and giving of your time and your wisdom, Dr. Ashby. And thank you for all you do, Simone. You are amazing. I can't wait for you to teach us how to eat live. And so I'm going to go on now to our Medical Mondays moment. Then I'm going to revert back to you, Dr. Ashby. And, you know, we give gifts to people who bring 10 people or more to the platform. And also we recognize others who have stood out one way or the other, or contributed one way or the other. Week after week, the Ajays, Dr. and Dr. Ephraim Hanna, have been, you know, always bringing 10 or more people. And you know what? They actually said, you know, we defer our gifts. But today, I'm going to give the gift today to our sister, Lola. She had been here from the beginning, faithful, diligent, and she brings people on the forum to come learn and better their health. She has a heart of gold. I'm unmuting you to just appreciate you, Sister Lola. Kindly unmute and say a word or two.
Oh, Dr. O, you just put me on the spot. I'm like, what? Thank you. I mean, you know, it's a beautiful thing you're doing. And every week after week, I learn so much and I enjoy it. And I try to tell people, it's like I can't tell people enough, please just listen one time, just come in. You can ask questions. So what can I say? I'm very grateful. Very grateful. Thank you so much. And thank you, Dr. Ashby. I love you. Thank you.
Thank you. Thank you so much. And we're going to be sending you an Amazon gift card.
Oh my goodness. Did you hear my son? My son said, Thank you. Thank you. Thank you so much. I appreciate it.
Thank
you, Dr. O. Thank you, Medical Mondays.
So, Dr. Ashby, I'm giving it back to you to give us, some, closing comments. But next week, before I hand back to you, we're going to bring our expert back on COVID. I've had so many questions on COVID. I felt that we needed to conclude the Cancer Awareness Month with this powerful session by Dr. Ashby, and then next week to talk about COVID. After Colin Powell's death, I've had so many questions. And so I feel that we need to get those answered, because this is what we're going through now. This is the pandemic we have now, and we are not quite at the end of it yet. So there's still so much to learn. So stay tuned next week. We'll see you next week. Now, Dr. Ashby, kindly give us some final words.
Well, I just want to thank everyone for hanging on for a few hours and for the questions. We learn most from each other and from listening. And I really appreciated the questions and the engagement. It's a journey. And I hope that we continue to get better at applying the little nuggets that we learn in small ways. And I'm always going to be here and available for us to, learn what's new, because that's what's keeping me engaged right now, is the new frontier in medicine and all of this reversible disease. I mean, it's looking bleak when we look at the growing numbers, but it's also at the same time inherently locked in with prevention and reversibility because of lifestyle. So it's really paradoxical. Heart disease, cancer, Alzheimer's, obesity, all of these chronic diseases are on the rise, but at the same time, we actually have the key. So I hope we'll be able to put into practice more and more of those keys and have us not end up being part of that herd that ends up, suffering the consequences of the established, status quo. So thank you all.
Thank you so much.
And thank you, Dr. O.
There's no better way to round this up than just to read what First Lady Karen McDaniel wrote here. She said, "Thank you, Dr. Ashby, for your time and expertise. Thank you for returning time and again. Looking forward to your return. Blessings." All right. Thank you so much. So please, if you would unmute and just, let's cheer and thank Dr. Ashby for this awesome session.
Thank you.
Thank you,
Dr.
Ashby.
Thank you, Dr. Ashby.
Bless you.
Thank you so much.
God bless you. And
Those
thank
hands.
you. Thank you so much. Thank you. I enjoy you so much.
She is
great.
Awesome. She's awesome.
And I really enjoy being here. Thank you so much, Dr. O.
This is a wonderful.
Have a wonderful night. The kids have been good.
Thank you. And say thank you to the children for, allowing you this time.
They've been very good. They enjoyed their game of Monopoly.
Fantastic. Thank you.
Thank you.
Good night, everybody.
Good night.
Good night,
everyone.
Good night.
See you next week.
Yes.
Good night.
Thank you, Dr. O. That was most unexpected. I mean, oh my God, Dr. O.
That's the way it's done. It's well deserved.
Thank you.
We don't just give gifts out. Well deserved.
I thank you.
Thank you. Thank you for who you are, and thank you for always wanting to bless others to make sure that everybody learns. Do you know how much you were behind my back. That last episode, I want my son to see it. I want this person to see. Can you put it on? When are you putting it on YouTube? When are you putting it? Where else can we see it? Do you remember how many calls, text messages?
Yeah. But it's real. It's good, and it's most informative. I think a lot of people need to. Even right now, as we were almost closed, I remember a friend that was complaining about her stomach, so I quickly texted her. I said, "Please join in and ask the questions about your stomach." But I don't know whether she got it or not. So,
she can still always ask it. You know how to do that.
Yes.
See, I won't disclose, but I know what I'm talking about, and you know I'm telling the truth.
Right.
That you are there to get, to just make sure everybody is fine. That's the heart we praise God for.
Thank you, Dr.
We really appreciate your Medical Mondays. And you know what? You are real. You are true. You don't sugarcoat.
Dr. O.